Hi, Tracy Tyson, pediatrician in Vermont, and I wanted to talk to you about ways to maximize your prenatal or meet and greet visits with your new pediatrician. So, if you've just moved to an area or you're trying to find a pediatrician for your family, if you're expecting a baby, these are some things to ask that can give you the most information about the office or pediatrician that you're going to see so that you get most comfortable. So, the first thing I would ask is, do they offer meet and greets? I think it's a really good sign if they do. Most places do, but if they don't, I think that should tell you something right there. So I think offering those meet and greets is important. These are not something that people charge for, so these are free of service. They're usually done at certain times when the pediatrician is not actively seeing other patients. So like I've sometimes done them during lunchtime or at the very end of the day so that I can also spend some extra time with families. So some other questions to ask is, do they offer something called patient-centered medical home? An easier way to say that is, are you assigned to a specific pediatrician or do you see everyone in the group? Most pediatricians have moved over to assigning a primary care provider because studies show that the more often you see one person in your clinic, the better overall your health outcomes are because that person knows you and is taking responsibility for your child's health. And so that's a really good question to ask. The other question to ask is about their same day availability. So how available is the practice if you need to call if your child is sick? Now, every place is going to fill up. I mean, my practice, we have around 8,500 patients that come to our practice. There's no way we could see all of them if they were sick, but we do have things set up to make sure that we have as much available as possible. So what is their same day visits and how are those appointments made? Also asking them who is on the phone answering calls when your child has a medical concern. So is it a front desk person? Is it a medical assistant? Is it an RN? An RN is a registered nurse who has extra training in giving medical advice over the phone. And so while not every office is able to provide that and it isn't always needed, it's something that's an added benefit, which means you might get a little bit of extra medical advice just when you call the practice where you don't always need to be seen in clinic. What is their policy on vaccinated versus unvaccinated children? Again, this is kind of a loaded topic, right? But you want to know what's important to your family and make sure that those values align with the practice that you're going to. I have some families coming in because they want to know, will I allow there to be a more modified vaccine schedule? Do I allow patients to come into the practice who don't vaccinate at all? And then I have families who want to know, what am I going to do to protect their vaccinated child or their infant or their medically complex child from children who are not vaccinated for preventable diseases. So what are the things that I'm going to do to keep their child safe? So I think those are great questions to ask because you don't want to wait until something comes up to know what the answers to these questions are. You also want to know, what is their on-call policy? Do they have someone answering the phone 24 hours a day? Is it an outside service? Do they share it with other practices? How does that work? So at my clinic, we actually pay a triage service, which is a company that hires pediatric emergency room nurses, and they take first call for us. So they're awake 24 hours a day. They go by a really, really sturdy protocol, and they reach out to us if they have questions or concerns, or if the family feels like they need more help. They then send us a message in the morning saying, hey, this family called. I recommended this, this, and this, and we usually call back to see if the family needs to be seen. Another question to ask is, what other services do they provide? Are there any mental health counselors in the office? Do they provide nutritional support? Is there any lactation support? Really finding out, especially if you're pregnant, what options do they have for newborns? Do they see patients on the weekends, or do you have to go back to the hospital to get your bilirubin checked? Asking about what labs can be done in office. Again, it's not necessarily a positive or negative, but just knowing what's available is something that's really helpful. If you can't get a urine test or a strep test, or they don't have blood draw abilities, that might be something, if you live in a really rural area where it takes 30 minutes to get to the local hospital, that could be something that's really important. Finding out overall what providers are in the office. Is it mostly medical doctors? Is there nurse practitioners, physician's assistants? How are those utilized? And what options do you have with seeing different providers in the office? So I hope these questions help, and send me some more things that you guys have had during prenatal visits if you have any questions. But writing down some of these questions, going in, understanding what it is that you're looking for, what's important for you and your family, and finding a practice or pediatrician that aligns with those values is going to make you the most successful and happy. Take care.